On this edition of Veterans Health Watch, we'll learn about construction projects throughout the VA Maryland healthcare system designed to meet the healthcare needs of our growing veteran population.
We'll also learn about some new customer service initiatives designed to help improve the programs and services we offer to our veterans.
Welcome to Veterans Health Watch, a program sponsored by the VA Maryland healthcare system to provide the latest in healthcare and benefits information to our veterans, their families, and the local community. My name is Chris Buser, and I'll be your host today.
And I'm Michael Rubin. We'll also learn about some new customer service initiatives designed to help enhance services and programs offered to our veterans.
For those who have been to the VA Maryland healthcare system over the past year, you know it's been a very busy year with construction and renovation projects. And joining us today to talk about that is our Acting Chief of Facilities and Engineering Service, Mr. Chris Smith. Chris, thanks for joining us today.
Thanks for having me.
Yeah. So how do you determine priorities for construction projects throughout the VA Maryland healthcare system?
We have to consider a lot of factors when determining priorities because there's a lot of construction needs. We look at the condition of our current facilities are in. We'll look ahead a couple years at our current and projected workload, access needs for veterans, security concerns that might arise. A whole lot of factors go into that.
So Chris, it sounds like these factors may have played a role in the determination to open the most recent outpatient clinic at Fort Meade?
Yeah, they did. We were projecting an increased need for primary care services, and our outpatient clinic in Glen Burnie is already operating pretty much at capacity. So by opening up a new outpatient clinic on the Fort Meade Army base adjacent to the Kimbrough Ambulatory Care Center, we were able to shift some of that workload away from Glen Burnie while making it more convenient for veterans to get service who live in Anne Arundel, Howard, Queen Anne's, and northern Prince George's counties.
Mm-hmm. And for the veterans in that area, what type of healthcare services are available at the new Fort Meade CBOC, Community-Based Outpatient Center?
The outpatient center, it's a 12,000 square foot facility, and we offer a wide range of healthcare services there. Specifically, we offer audiology, optometry, primary care, and women's health services.
Now I understand that it's a green facility. Why is it so important to develop environmentally friendly buildings?
Yes, it is a green facility. As a matter of fact, the Fort Meade Outpatient Clinic is the first VA outpatient clinic in the whole country that was awarded a LEED certification, and LEED stands for Leadership in Energy and Environmental Design. When we design projects, we not only have to take into consideration the needs of our staff and the veterans they serve, but also our environmental impact and energy efficiency. Through this design, we were able to meet some of the federal government's green policy initiatives by using energy efficient design techniques. We have geothermal mechanical systems, low flow water fixtures. We have energy efficient glazing on the windows, and we have motion controlled lighting as well.
Great. And for the veterans who've been to the Baltimore VA Medical Center, they've probably noticed that the atrium and lobby project has recently wrapped up. What other projects have been going on at this inpatient facility?
We are just about to wrap up another big project. We've constructed a radiation oncology suite at the Baltimore VA Medical Center. Currently, right now, we contract out those services, so if veterans need radiation therapy treatment, they have to travel to another facility. Once this program is up and running, they'll be able to receive all their oncology treatments at the Baltimore VA Medical Center, which will cut down on the time and stress that traveling between multiple facilities entails. So we're really happy about that.
Now, I was recently out at the Loch Raven facility. It's hard not to notice all the construction. Can you describe for us the construction process and how it's going to help to expand services?
Yeah, specifically at the Loch Raven campus, we've added an expansion onto the Community Living and Rehabilitation Center. The new space that we added will allow us to combine the physical and rehabilitative therapy services and the ancillary support programs that go with them. Previously, they were fragmented and it wasn't really an efficient design for the staff or the veterans. We are also able to add a dedicated chapel and some large multi-purpose spaces for the residents of the Community Living Center to use. When we were designing this project, we met with the staff at Loch Raven and talked to them to get a feel for what they would need to do their jobs better to support the veterans. And then we took those considerations into the design phase of the project to work on something that would make everybody happy.
Mm-hmm. Yeah. Well, Chris, this has been very interesting, and right now we're going to take a short break and we'll be coming back to learn more about some of the exciting projects that we have that will enhance the patient satisfaction and experience at the VA Maryland Healthcare Center. So please join us back in a few moments.
The VA Maryland healthcare system is the overall healthcare system for veterans in the state of Maryland.
We have 3 inpatient locations as well as 6 community-based outpatient clinics.
The treatment that I've received from the Maryland VA healthcare system, it's been top-notch, definitely cutting edge.
I think what makes the VA innovative is constantly exploring new ways to become more efficient and more effective. We were the first hospital in the world to make the transition from film-based radiology to filmless radiology.
We measure everything we do. We are always keeping track of our ability to deliver the standard of medical care to all our patients. We have the most committed, diverse, and caring group of professionals.
You know, a lot of us have served in the services. These guys and these ladies, I mean, they're everything to us. And there's nothing I would not do for them.
Welcome back to Veterans Health Watch. Rejoining us is Chris Smith, the Acting Chief of Facilities and Engineering Services at the VA Maryland Healthcare System. He's going to tell us more about our exciting renovation and construction projects throughout the VA Maryland Healthcare System. Chris, I often see that when a construction project starts, sometimes it can go over as far as its time limit is concerned. Can you tell us a little bit about the process, about selecting a contractor and what happens after that point?
Yeah, after we select a contractor for a job, there's actually a lot of administrative work that has to take place before they can begin construction. Mm-hmm. For example, their workers all have to go through security to get badging, and they have to get their bonding together. Once the contractor feels they're ready to move forward, we'll have a pre-construction meeting with the engineering and the contractor and all the stakeholders for the individual project. And that's really the point where we talk about phasing, the impact, the schedule, and the special considerations you have to put in place when you're working in a healthcare environment. Then they'll begin construction, and if anything unforeseen pops up during construction, we'll have to meet with the contractor again and negotiate a fair and reasonable time extension if that's required, and restart the schedule from there. So it's really a kind of a living process as you move through. It's constant change.
So how do we ensure the safety of our veterans as well as avoid a disruption in healthcare services during ongoing construction throughout the system?
Obviously, maintaining a safe environment is very important, and so is minimizing the impact of clinical services. When we design a project from the very beginning, we have to consider what phasing is going to allow us to get the job done but have minimal impact on the surrounding areas. So that's planned in from the very beginning. Safety is also planned in from the beginning. Engineering actually leads a multidisciplinary team to look at the project and think about infection control, life safety, and other issues. And we'll develop a list of requirements that the contractor has to adhere to maintain a safe environment. For example, they have to have partition walls to separate off the workspace. Mm-hmm. They may be required to keep the entire construction site under negative pressure, and potentially even HEPA filter all the exhaust that leaves the construction site. And we monitor that continuously throughout the life of the project.
Wow. Chris, I want to switch gears a little bit and talk about some of the exciting projects that are going on at our 365-acre property at Perry Point. Can you tell us a little bit about what's going on that campus?
Yeah, we are getting ready to start a project to renovate building 80H to provide enhanced mental health services. Specifically, we'll be adding 5,000 square feet of new space to 80H for clinical programs for OIF, OAF veterans. We'll also be renovating the entire building itself to provide a more patient-centered environment. and to upgrade the air conditioning and heating systems to provide greater level of comfort and control for the staff and patients.
I also understand that Building 22 is having some renovations done, and that's the location of our inpatient substance abuse program.
Yeah, correct. Actually, that is underway. We are renovating that building. That building was originally constructed in 1942, so we needed to do a full renovation to bring it up to provide the highest level of care for our veterans. So we're doing a complete renovation of the interior, the structural systems, building, utilities, with a focus on trying to have good patient privacy, to update the treatment areas and the residential spaces as well. So it's a very comprehensive project because it's a very old building.
Yeah. And as you drive into Perry Point, I see that there's been a new truck entrance that's been completed. What was the reason for this new truck entrance?
The purpose of the truck entrance is to provide an alternate route for large trucks and construction vehicles to get into the Perry Point campus without disrupting traffic in the town of Perryville and without obstructing the main entrance into Perry Point that's used by staff and patients. The project itself is using a strip of road that is pre-existing in the park above the Perry Point campus. We added some additional roadways leading to the Perry Point warehouse. We also constructed a guard shack and put a locking gate there to enhance security so we can prevent any unauthorized access onto or out of the campus through this alternate entrance.
So Chris, since the last time we had a VA Maryland healthcare system construction update, I understand on the Eastern Shore the Pocomoke City community-based outpatient clinic has relocated?
Yeah, that's correct. Engineering works in collaboration with all the other departments in the VA Maryland healthcare system, and we identified that there was an increased need for services beyond what the old location could support. So we did have to lease a larger building in Pocomoke City to accommodate that need. So we planned the build out for that space specifically to address the healthcare needs of the veterans of Maryland's lower Eastern Shore. Mm-hmm. And we've recently completed that and the building is operational.
Excellent. So for folks who are sitting at home and they want to learn more about construction projects or renovations that are going on throughout the VA Maryland healthcare system, where can they turn to get more updated information?
Go to our website. The VA Maryland Healthcare System's website has updated construction information right off the main page.
Excellent. I appreciate that. Well, thank you so much for joining us. We're going to take a short break now, and when we return, we're going to learn more about some exciting new customer service initiatives going on throughout the VA Maryland healthcare system. Please join us back.
We're proud of the services that we offer to veterans returning from conflict.
The VA has case managers, both social workers and nurses, who are experts in helping them transition from the military into the VA system.
We make sure that they are aware of all the services that are offered to them.
We're getting them almost right off the battlefield and into the type of care that they need. And this is different than what we've ever done for any other war era.
The VA was very proactive. It does make you feel like you're getting top-notch quality care.
Did you know that Department of Veterans Affairs provides physical and mental health care for over 8 million veterans? Hi, I'm Natalie Dell. I may be an Olympic medal winner, but I know that real champions are those who have served this country, and VA knows that too. As a VA employee, I've seen the challenges our veterans face. I'm honored to be part of a team that supports veterans in achieving fuller, richer lives, and I invite you to join us in this rewarding experience. If you're a mental health provider, I urge you to visit vacareers.va.gov.
Welcome back to Veterans Health Watch. In this segment, we're going to learn about some exciting new customer service initiatives. Joining us this time is U.S. Army veteran Linda Kelson, Director of Veterans Health Education for the VA Maryland Healthcare System. Thanks for joining us today.
It's my pleasure.
Great. So I've been hearing a lot about this exciting new customer service initiative that allows our hospitalized veterans to access things like games, education, movies, and the internet from their hospital beds. I believe it's the Get Well Network. Can you tell us a little bit about this Get Well Network?
Yes, I can, Chris. The Get Well Network is an interactive patient care experience. You're right, they can play games, they can use their email, they can watch first-run movies, and they can watch television, but it's so much more than that. they can actually have all of their education delivered through the Get Well Network. So when we get this up and running to its absolute maximum benefit, we'll be able to deliver education on almost any topic that the physicians and nurses want to deliver, as well as on medications, and we're also going to be able to ask them questions of the day. So we can ask them, how do they feel about the service that they're getting? Do they think that their room is warm enough or clean enough? And it's really about asking the patient how they feel about their experience while they're in that bed, and not just about us, going in and checking on the patient.
Well, it sounds like there's a lot that they can utilize the program for. Is there anything else that they can expect from the Get Well Network?
One of the things that they can connect to is their My Healthy Vet account.
Okay.
And the My Healthy Vet account, of course, is our web-based personal health record. And we want every veteran to be able to register for that program. Right now, if the veteran goes and clicks on My Healthy Vet and indicates that they would like to use the My Healthy Vet program, we get notified that the veteran is interested, and then I send staff up to actually meet with that veteran to find out what their need is with the My Healthy Vet program. We can register them, in-person authenticate them, and set them up for secure messaging, all while they're in their hospital bed. They can actually access their accounts, and as you know, there are a lot of new features in My Healthy Vet. One is the Veterans Health Library, which is very extensive, so we can also tap into that as part of this whole process with the Get Well Network.
Linda, are there other ways that My Healthy Vet and the Get Well Network interact with one another?
Well, as I said, one of the ways is through the Veterans Health Library, but also secure messaging. So Get Well Network and secure messaging will be able to work together. One of the things we're looking for is how can we bundle things so that when a veteran has a particular need that maybe isn't in the Get Well Network library, that we can actually bundle something from the Veterans Health Library and have that sent to the patient so that the patient can actually just retrieve it right there on the screen in their room. Now that's probably a procedure that we're not going to be able to do right away, because that takes some connectivity that's going to take time to build, but it's something that we're shooting for in the future.
So how could the VA staff use the Get Well Network to support veterans in their care and their treatment?
Well, one of the things they can do is they can go into any patient room, and using the console that's in the room, what we call the all-in-one, they can assign that patient education that is specific to their needs. So they can pick movies. Let's say the patient is admitted for congestive heart failure. They can pick one of 6 or 7 different movies on congestive heart failure. They can pick a film that has to do with their diet or how to manage their fluid intake. And then they can also select information about various medications. One of the things that we're doing, that the work group has been doing, is we've been building clinical pathways. And so from the very start, when the patient is admitted, we will have a discharge clinical pathway. So the patient will be prepared from the moment they come in, which sounds a little silly, I know, but they will know what the expectations are. So we are concentrating on things like making sure that the veteran knows that before they go home, we want them to know what their medications are, what their disease is about, and what they need to do to take care of themselves when they go home, when their next appointment is, how they can reach their doctor, and do they have a ride home? All of those things are really critical. So they're going to be prompted about those things during the time that they're with us. If they have a disease-specific illness, we'll be building clinical pathways to, again, address those particular conditions like congestive heart failure or pain management. If a patient has pain, we will be cueing them when they get their pain medication and asking them, did this satisfy your pain? Are you feeling better? And if not, it will prompt the nurse to come into the room to reevaluate the patient.
Great. Well, this sounds like some really exciting interactive technology. In our last couple of minutes, can you tell us about some more things that the VA Maryland healthcare system is putting in place to help support veterans and the staff?
Well, one of the things is the management console. The management console will allow us to actually measure how well we're doing this. So we'll be able to see exactly how many films are being viewed by the veterans, particularly which education films, which ones are successful, maybe which ones aren't so successful. We'll also be able to see compliments and other comments. We have seen a surge in compliments since we've initiated the system that we have involved so far. And we're actually able to feed back to the staff. We have one nurse on 3A who has received, it must be at this point, 50 different compliments from various patients because she is so popular. But not just her, there are other physicians and nurses and techs. But we'll also be able to evaluate patient satisfaction using this program, and that is something that's really exciting. And we can respond immediately. If a patient has a concern, we will be able to go right up and address that concern as soon as we get the message, because the Management Council will allow us to do that.
Well, actually, that kind of answers the question that I was thinking of, so I really appreciate the well-rounded response.
Yeah. For our veterans who want to learn more about these exciting initiatives, where can they go to get additional information?
Well, they can call me. My number, I don't have the 800 number, but my number is 410-605-7178. And I'm in the office usually Monday through Friday, 7:30 to 4 every day. And I'll be happy to answer any questions that they have.
Excellent. Well, thank you so much for sharing this exciting information and for being so open to explain additionally to our veterans in the future. We're going to take a quick break right now. When we come back, we're going to learn more about some other exciting customer service initiatives, particularly the VA's Gourmet Dining Program. So please come back and join us in a few moments.
The best thing about long-term care is that we look at our residents, we don't call them patients, they're residents. They don't live in our facility, we work in their home. So the environment, it's a home-like environment. We look at them for what makes them special. What are their preferences? What are their uniqueness?
I am very happy and secure to know that he's somewhere where he's being cared for. I know that he's safe. They're never just sitting idle. They do have trips. They understand different things about them and they'll explain it to us.
Other than a community living center, we provide rehabilitation services and post-acute services. So not everybody is a nursing home resident, so they may be called patients. We all work together to make sure that we plan and provide the compassionate, safe environment for our veterans.
Welcome back to Veterans Health Watch. In this segment, we're going to learn about an exciting new customer service initiative, the VA Gourmet Room Service Dining Program. Joining us to talk about that is Valerie Adegunle. She is the site manager for nutrition and food services at the Baltimore VA Medical Center and the Loch Raven campus. Thanks for joining us, Valerie.
Thanks for having me.
Great. Tell us a little bit about this new exciting program. What is VA Gourmet?
Sure, it's the VA Maryland Healthcare System's answer to room service dining as if you were in a hotel. So the patients call down and can order their food, anything they want, and we deliver it within 45 minutes. We have a new computerized system and we have a call center ready to take their calls, and we're very excited about it. We cook to order, so they get a restaurant-style menu, and it's a fantastic program.
So you're telling us that they can order whatever they want, whenever they want?
Yeah, I mean, our phones open at 6:30 a.m. and close at 7 p.m. So anytime between 6:30 and 7, they can call and order whatever's on their menu, and we will deliver it within 45 minutes. They can call at 10 a.m. and say they want lunch at 2, and we'll accommodate that. So it's really up to the veteran to choose when they want to eat and what they want to eat.
Yeah. And with all these people ordering different things at different times, how do you get all that to work?
It's a really intricate system. I mean, we have a lot of staff, specialized staff that have been trained to handle all of this. We have ambassadors on the unit to help the patients and help the nursing staff to navigate the new program. And then we have a call center. That's, I think, the key piece for the veterans. That the new computer, and they can enter the system in there. It tells us what the patients are allergic to and all sorts of fancy things to make sure they get what they need and help them aid in their recovery or their treatment plan.
So what if they require a special diet?
Specialized diets, we actually have 9 different menus, and the menus have an education panel on the back and explain their restrictions. So it's an education piece that the dietitians can use to help the patients understand their medical orders. And we'll be limited to some degree with what they can have. depending on their diet. But we accommodate that by giving them their choices that they are allowed to have.
What about for some of our veterans who aren't able to make his or her own choices?
It would depend on their abilities. So if the patient has a difficult time with the phone or maybe can't read the menu, our ambassadors would go to their bedside and take their order for them. And the ambassadors would then be able to communicate that to the kitchen. Or if maybe a family member could assist them in making the orders. At times the nursing staff has been assisting them in making their orders. If they're really too ill to make their choices at all or be able to verbalize their wishes for what they'd like to have, we do have the mechanism to give them just a well-balanced meal at a standard delivery time to accommodate, make sure they get fed.
Now this is really a practical question, actually. You know, veterans are visited by their loved ones or friends and family. So are they able to order?
Absolutely. Guest meals are available. There's a cost to the guest, but they can call down. Same process. If they call the call center, it's indicated in the computer system as a guest, and they can get their tray at the same time as their loved one.
That's great, because not a lot of hospitals offer that type of service. So is it only available in Baltimore, or are there other areas in the healthcare system?
Right now, room service really only enables itself to acute care. So it's just the Baltimore facility that's able to provide room service. We're looking at other types of enhanced dining with choices for veterans in our other 2 locations.
And if a family member or a veteran wants to learn more about this program, where should they turn for additional information?
Sure, they can call our offices. Our number is 410-605-7052. That's our administrative office, and any of us would be happy to answer their questions.
Now, Valerie, I know when someone's in the hospital, a lot of times their doctor wants them to have a very specialized diet. It may not be the most exciting diet. How does a doctor make that determination, and how does nutrition and food service play a role in that?
Well, ideally, the physician would work with their interdisciplinary team. The dietitians work very closely with the medical teams to make recommendations for diets. And it's really based on their medical condition and disease processes. If there's a particular organ that's having issues, that's what the diets impact. So there's certain nutrients that will impact that. And the dietitians play the key role in educating the patients and helping them understand which foods would be a better choice. And that's how we really handle that. Those diet orders come down to the kitchen, and if the diet orders aren't signed off by the physician, we're not allowed to feed them yet. So we do work with that team, even through the kitchen, to accommodate and make sure that everybody is in understanding and gets fed when they would like to be fed, the best of our ability. Not everybody is able to be fed right away, which is a difficult thing to handle.
So in terms of speaking about being fed, could I take a look at the menu?
Sure, sure.
Any recommendations?
The pork chop is fantastic.
Excellent. Well, Valerie, thank you so much for explaining this. I know anywhere you go, whether it's a hospital or a hotel, the dining experience is part of that overall customer service experience. So we really thank you for sharing that information today.
Thank you for allowing me to share it.
Great. And that wraps up today's episode of Veterans Health Watch. If you have a suggestion for future shows, we'd like to hear about it. You can call us at 1-800-463-6295, extension 7101, or you can join us on the web at www.maryland.va.gov.
If you are a veteran or you know a veteran in need of VA health care, please call 1-800-463-6295, extension 7324. Visit your local VA medical center, or join us online. You can follow us on Facebook and Twitter. Please join us next time. We look forward to hearing from you.
A lot of women veterans don't realize that the VA is here to take care of them. They served and they deserve the best health care that there is. The Women Veterans Program has been redesigned to meet the needs of the women veterans.
Female veterans receive just as good a care as men because they're focused more on us now.
We want them to come here, we want them to feel welcomed, and we want them to know that we are capable and willing to take care of them.